I'm Dr. Danny Lehnert, a physical therapist, strength coach, and baseball coach. And this week, I want to talk about spondylolisthesis, specifically how it relates to baseball players. So first, I think it's important to understand what spondylolisthesis is. It usually refers to an injury in the lumbar spine or the low back, typically at L5, which is the lowest level of the lumbar spine. What happens is our spine looks like this. So imagine we have a bunch of segments here. You have the body of your spine, and then back here you have what are called the facet joints that are above and below that kind of help with your bones moving on each other. What can happen is the pars interarticularis, which refers to the small area here that connects the facet joints, can fracture. Usually that happens from repetitive stress, typically extension and or rotation, which is most often how it happens in baseball. Someone will take a bunch of swings or throws and repeatedly grind on their back until they get a fracture there. Now, if it just fractures, you have what's called a spondylolysis, which just refers to the fact that the bone has separated a little bit. Now, this typically does heal with conservative care. Surgery is not typically recommended, especially in young athletes. You just need time of relative rest and stability, and eventually that bone will fuse back onto the rest of the bones. Now, spondylolisthesis is a more extreme case. What happens is you have the spondylolysis, so the fracture, and then you actually see the vertebra start to move forward. It comes off of its line because the vertebrae are kind of an S shape in our body, but they roughly sit on top of each other to absorb force, to not create too much shear. So with the spondylolisthesis, you start to see the vertebral body migrate forward. Now there can be different grades, 1 through 4, depending on how far forward it is, 25, 50, 75, or 100% forward. 25% forward is most common. Sometimes that's asymptomatic. You don't even know that you have that little shearing there. But the more it moves forward, the more stress it can put in the low back. Typically, you're going to get low back pain in that area, especially with that extension and rotation like we were talking about. And it's going to have to be a more aggressive time of rest and stability in this area to let that happen. So over the next few things I want to talk about, I want to discuss from a physical therapy perspective what we can do to modify symptoms with spondylolisthesis, some exercises I like to use with my athletes to get them feeling better, and just give you an overall idea of what physical therapy looks like for spondylolisthesis in baseball athletes. When it comes to spondylolisthesis, as I mentioned, extension and rotation are the most painful motions that tend to aggravate things. So you're going to want to avoid those positions. I rarely try to tell people how to sleep because that is kind of a personal preference of what your body's built up over time. But a simple hint is to use a pillow between your knees because that's going to prevent rotation laying on your side, and to try laying on your side because that's going to bring your legs up into a more flexed position. It's going to typically relax your low back. If you are someone who has to sleep on your back, putting a pillow under your knees can take some tension off of the back. Sleeping on your stomach is going to be the most painful typically. If you really can't sleep any other way, putting pillows under your stomach to try to bring it up so you're a little bit flexed forward is a good idea. Sitting is going to be the most comfortable position typically for folks dealing with spondylolisthesis, but they're going to get stiff doing it. So you do need to be moving about, but sitting is going to be the most comfortable. If you're looking to do some sort of cardio, usually stationary bike, things like that are a little bit easier to handle than walking. And sitting exercises are the best thing to start with. I'll go over some specific exercises, but it's important to understand that that flexed position and then keeping everything relatively stable, no aggressive rotation or anything like that early on. I don't like resting athletes, but in this case, you typically do have to rest to make sure everything heals appropriately, because if you don't give it adequate rest and stability, the problem can only get worse and linger. And I've seen athletes go through that. It's a really difficult process. You want to nip this in the bud when you're dealing with spondylolisthesis as soon as possible. Early on in the rehab process with spondylolisthesis, we want to prevent muscle guarding in the area. Now, your muscles are going to be turned on to guard because you can imagine with your spine slipping a little bit, those muscles are going to be holding on for dear life, but that can often cause more pain than what we want, especially when some of those big muscles like your quadratus lumborum are kicking on. So what I love to use is dry needling to get the muscles to relax. Now, I'm old school in that I've been dry needling for almost 10 years now. When I had learned it, we didn't know about electricity, or we didn't really use it a ton. But I've come around where we're using a lot of e-stim now at Eclipse Wellness with athletes who are dealing with any sort of muscular pain, but especially spondylolisthesis, of putting the needles in, letting them twitch. Think of it as, I love the Mark Pro, I love dry needling. You're kind of combining it together, getting the muscle to twitch for a few minutes and then relax is in my opinion, and research shows, causing better relief than the traditional piston technique of dry needling. So I like to do dry needling early as soon as the athlete is okay with it, just to get things to relax, and that kind of helps calm down that area, decrease that inflammation, and get everything moving early in the rehab process. Early on in the rehab process with spondylolisthesis or many other injuries, I love an isometric exercise, which is contracting the muscle without forcing it to move too much, so it limits damage that the muscle goes through. So a peel-off press is an easy way to introduce isometrics for rotation. So what we're doing is we're coming out here, feet shoulder width apart, bend the knees a little bit, a slightly athletic stance. Think about lightly engaging the core here, and we're just going to be pushing in and out like this, not letting the band rotate us. Now that becomes pretty easy pretty quickly. So we start with putting one foot in front of the other. I like to do the outside foot in front here. It challenges stability a little bit more. And same thing, we're going in and out like that. You can start doing things like one foot. You can also play around with what movement you're doing. So you can start by going all the way up and down. That's going to force you to avoid extension as you're going back through there. When we start getting stronger, we'll start doing a little bit of rotation. You can obviously do a heavier band. You can hold. There's a million iterations that you can do here. This shouldn't be the end goal, but it's a great starting point, especially if you're dealing with nagging pain. Isometrics are a great way to start to push yourself and get those muscles stronger without overdoing it, to kind of get you over an initial hump in the rehab process. Early on in the rehab process, we want to avoid a lot of motion through the lumbar spine where the spondylolisthesis actually occurred. So we want to make sure as we're opening up range of motion elsewhere to spare that lumbar spine to let healing occur, but also let us get back to doing activity sooner because we're able to move in different areas. So areas we want to look at when it comes to extension through here instead of the lumbar spine are the thoracic spine and the hips, the segment above and the segment below. So with the thoracic spine, a foam roller is a great way to do it. We just want to make sure we're actually using the thoracic spine and not just going through the lumbar spine for extension. So we want to lay on our back here, do a little bridge up like this. I love giving yourself a bear hug to kind of separate the shoulder blades so you have more room there. And what we're thinking about is we're just trying to roll back and forth through here, mobilizing the thoracic spine gently as we're doing it like that. What we don't want is to drop our hips down and extend through here because you can see a lot of that movement comes from my lumbar spine. We're trying to just move through the thoracic spine. It's not nearly as aggressive as a stretch, but it's going to help protect that lumbar spine when we're dealing with pain and inflammation. The next thing we want to do is look at hip extension. So we're going to come over here. We're going to have one foot up like this. We're going to think about leaning forward to stretch our hip flexors in this leg. Now, a lot of people do this stretch incorrectly because they'll stretch their lumbar spine. So what you want to do when we're up in this position is you want to think about posterior pelvic tilting. So tucking your tail kind of like this. And as soon as I get in that position, I already start to feel some tension in my quad and in my hip flexor here. So it's a much smaller movement of a stretch here. If you find yourself stretching and you're going all the way like this to stretch, you're irritating your lumbar spine and you're missing your hip flexors. So think about resetting, pelvic tilt here. You can think about squeezing the glutes a little bit. That helps. Some people understand it. And then sliding forward through there, you should feel a more aggressive stretch. Obviously trying that on both sides. The goal of any rehab program should be to change your activity as little as possible while still letting you heal. So when we're dealing with spondylolisthesis, it can often be painful to back squat with a barbell or anything like that, because having something on our back like that tends to already put us into extension, relatively speaking. Now you can try different things. You can put your heels up, you can have a box behind you or something like that to limit the extension, but sometimes that position is too provocative. That doesn't mean we should stop squatting, because then we're gonna have other issues when we do finally recover and our legs are weak and we have another injury that way because we weren't ready to get back on the field and we lost a lot of momentum from taking 6-8 weeks off of squatting. So holding a weight in front of you is an easy way to fix that. Now, maybe you can't hold as much weight when you do that, but you can still challenge yourself in a similar way. When I'm here, I'm naturally going to be in this position a little more straight up and down versus if I have something on my back, I'm going to be a little bit more extended. And I can go down through here and stay way more upright with my movement. Now, I may still have to limit my range of motion. I may have to elevate my heels, something like that. But it's an easy way to scale to still keep squatting and keep your legs strong while you're recovering from a spondylolisthesis. The last exercise I want to show when it comes to recovering from spondylolisthesis is way later in the rehab process. So the mistake a lot of folks will make when it comes to baseball players is they'll try to keep them very stable through the lumbar spine, which is important early on in the process, but then they never gain the range of motion or mobility back, and they get hesitant with throwing. And that leads to an arm injury, or their velo's down, or they're just not performing as well and they get frustrated. So we want to make sure we're integrating rotation into throwing as early as possible once we're cleared to do so and once we're able to handle it. So an exercise I love is laying on your back here. I like to use a heavier plyo ball, and I'll just have athletes kind of rotate through here. So this is putting some shear on the low back, but we're getting ready to handle it. We're cocking our arm back here. We're feeling a rotation through here, and then a throw up like that. So it's just rotating here, feeling the stretch through our pelvis, coming through, and throwing like that and starting to understand the relationship between my pelvis and low back moving, leading to loading through my shoulder and then releasing the ball. And you can get pretty aggressive with this early on once you're cleared to do so. And it really helps you start to sync up the chain from the pelvis all the way through the arm. So those are the rationale behind physical therapy as it relates to spondylolisthesis in baseball players. Obviously, that's just a very small snapshot of exercise and activity I like to use. Usually, if you're dealing with significant spondylolisthesis, you're going to be shutting down for 6 weeks just to let everything heal. So that's a long time of working on soft tissue mobility, work on mobility of surrounding areas, gentle strengthening, maybe beginning some isometrics. It's a long process, but the thing to remember is you have to be conservative at first. This is not an injury to rush, especially if you're a young athlete. You do not want to be dealing with this long term. I've seen athletes dealing with it long term. It's not fun. You want to nip it in the bud as soon as possible. That being said, when you do get cleared, you do want to get back to stressful activities that represent throwing, like the one I showed laying on the ground, where you do need to be twisting through your low back and extending. Similar with swinging, I'll see a lot of physical therapists who will teach people that they need to just be a block like this, and then when people go to swing for the first time, they use their hips and then they feel pain because they haven't actually trained that separation through there, or they lose a lot of power because they start just rotating as one segment and lose that kind of whip that we want when we're swinging or we're throwing. So find a physical therapist who understands baseball players and can take you from that beginning, the conservative side of things, all the way to the end of being aggressive, getting you ready for throwing and swinging hard. If you're in the Sterling, Virginia area, you're always welcome to reach out to us at Eclipse Wellness. If you have any questions, let me know below, and thank you again for watching.